Salford is the 18th most deprived local authority area in the country, so big health inequalities. We've got 20% of the population with long-term conditions. We've got over 40,000 people with anxiety, depression and mental ill health. So a significant number of health needs. The role social prescribing can play is massive in all of those in terms of providing that support both locally and personally to support people in the way they want and need to. And lots of examples where people are starting to either get back into work or get to a point where they're able to then engage in therapy. There's lots of examples where people are able to use this much more non-medicalised intervention to improve their outcomes. We've had about 2,000 people go through our social prescribing service, tapping into about 800 different organisations in the city. The partnership with VCSE sector is absolutely vital, because if we didn't have a good infrastructure in our VCSE sector, it becomes more difficult for the community connectors to do the connecting. This place we're in now is called START, one of our Wellbeing Matters social prescribing anchor organisations. So we have 6 different organisations who have come together as a kind of consortium in the voluntary sector, supported by our local CVS. And they also have a key role in our new Living Well service, which is a service we've developed for particularly people who are too complex for primary care but don't meet current thresholds around secondary care. But when we had started that design process, we needed to make sure that it complemented our social prescribing offer around Wellbeing Matters. What START were able to then do was really start to think about people's onward journey and thinking about how they could provide them with support to access work or education or build relationships or whatever the things that were key in terms of their life goals.
I see my practice as a community anchor. Poverty impacts hugely on health. In fact, 80% of the determinants of health have nothing to do with medicine. So it's based on things like education, work, finances, relationships. We're very lucky that we have what's called Viaduct Care Kick, and that's a community interest company that includes all 36 GP practices, and we employ all the link workers for the Stockport practices. We know 4 generations of a family, and that's the brilliant thing about being a GP. You do know your patients, but when you identify there's something non-medical, we've now got something where we can really make a difference, and that's where Rod comes in. And because he's got the time and the capacity to really support that individual, and he knows what the destinations are where he can signpost them to. Sometimes he'll accompany them. He actually attends the allotment on a Tuesday afternoon.
So any new people who like to attend, I meet them outside the surgery. We have a walk over, introduce them to everybody else, and I put the kettle on, we have a brew, have a chat, and then a lot of people like to go out and do a bit of gardening. This is just the beginning, because then patients what initially come here to do that bit of social isolation regarding the gardening, they've made friends, and then they meet each other for a coffee, and then it expands, and then they start to feel more confidence, more self-belief in themselves.
A good example was a gentleman patient. He's never trusted people, and so engaging in conversation with him, encouraging him with all the social prescribing we've got, and having Rod as a wellbeing officer to help, to encourage him to meet people, to be able to trust people, to go outdoors, to get involved in activities, that's made a massive change into his life. Massive change.
We started this project about 7 months ago, and we have volunteers that come down every Thursday. The whole premise around it was to offer something alternative to medical prescriptions as part of people's health and well-being, and to build on that concept of using green spaces to improve your mental health. It's been very, very successful. The patients have really enjoyed it, but also they've transformed the canal itself in terms of it being a much nicer place and a much safer place to be.
Some of the volunteers, when they first turned up, did have various issues, so lacked a lot of confidence. Several real anxiety issues, but obviously as the project's progressed, we've seen like a huge difference in their outcome really. So Tommy was obviously a young man, from what I believe, never really came out of his house, and now he's a completely different person. And Tommy's even taken on a lead role within that group now, which is it's a huge difference and amazing to see.